All right, let's discuss approaches for total hip arthroplasty. The three main approaches for total hip arthroplasty are the anterior approach, the lateral approach, and the posterior approach, or anterior lateral approach. My preferred approach for first-time hip replacements would be the anterior approach. It's a more minimally invasive surgery where we don't cut any muscles. We just move those muscles out of the way. Patients have been shown to have better outcomes, faster recovery, less pain, and some studies even suggest lower risk of dislocation. You don't have any restrictions after the surgery, so patients tend to recover a lot faster. We do a lot of these surgeries where patients go home the same day after the surgery and don't even really need any physical therapy after the surgery. As far as the other approaches, that lateral approach or anterior lateral approach cuts a muscle to the hip called the abductor musculature, or the glute medius. And we repair that muscle back, but what we've seen is patients can have a prolonged significant limp after that type of surgery, so that one's not really done as much. And then the last approach is the posterior approach, where it's more maximally invasive surgery to give us a wider exposure, mostly for revision total hip arthroplasty. That's when I use the approach the most, to give me a bigger exposure to be able to access the implants that are in there, remove them, and perform any revision work I need. We split the gluteus maximus muscle, and we also cut the posterior hip external rotator muscles from the femur, and then repair those back after the surgery. And then patients typically have restrictions after the surgery for about 6 weeks where you can't cross your leg or bend down past 90 degrees. And that's to help prevent dislocations and allow those muscles to heal back. So as I've said, for first-time hip replacements, I would prefer the anterior approach. No restrictions, less pain, faster recovery, and better outcomes.